Thank you, Mr. President. Colleagues, I'm honored today to bring you Senate Bill 1503A. The bill creates a 17-member task force on community safety and firearm suicide prevention to study issues related to public health best practices for reducing deaths from community safety threats and suicide prevention. Suicide rates have been on the rise and continue to increase across the country since the COVID-19 pandemic. There have been promising signs that youth suicide rates may be decreasing, but Oregon's overall rate for all age groups is still tragically increasing. We lose 2 Oregonians every single day to suicide. It is just one of the leading causes of preventable death in our state. Oregon continues to have the 17th highest suicide rate in the nation, and this is just unacceptable. We have to do more to save lives. In Oregon, firearms are involved in the vast majority of suicides each year, with veterans, men, and our senior citizens at particular risk. The task force created by this bill is critical so we can continue our collective efforts to apply a public health lens to violence, overcome stigma around mental health, and support our neighbors who are most vulnerable. We've taken such action in recent session with Senator Hansel's Agri-Stress Helpline and Addie's Act to require student suicide plans in our schools. The measure directs the Department of Justice to provide staff support to the task force and appropriate $250,000 general fund to DOJ to contract with a third party to provide data-informed research and support requested by the task force. The task force sunsets on December 31st of 2026. I want to thank my colleagues, the senator from Springfield and Eugene and the senator from Eastern Oregon, who worked with me on this bill. There were several amendments added to the legislation based on those conversations, and I strongly believe that this bill is better for their feedback. Among these changes was expanding the task force to include a firearm safety representative and a law enforcement officer. In addition, the task force will have a broad range of stakeholders appointed by the governor, including a youth mental health professional, a tribal representative from a suicide prevention program, a public health researcher, a veterans mental health professional, and a person with lived family experience. Additionally, the task force will have 4 legislators, 1 from each legislative caucus. Senate Bill 1503A instructs the task force to dive into a number of vital questions around firearm suicide and associated community safety risks. Can we ask ourselves honestly, how do we better support youth and rural Oregonians expressing suicidal ideation? How does domestic violence intersect with community safety and suicide? What are the current community safety protocols around the state and across the country, including at our hospitals and behavioral health facilities? I believe we need to have the courage to confront these issues, and I urge your support for Senate Bill 1503A.